Hello, and thanks for joining us for the first of two student and family open forums this week. I'm Amy Bingham, and I'll be moderating today's session. Since Restart WKU committees began meeting in April, a tremendous amount of work has gone into developing the strategies and guidelines that will allow us to safely return to the Hill in 3 weeks. We know that students and their families likely have many questions about how the WKU experience will look a little different this year. These forums are designed to give you the opportunity to have your questions answered. We will begin today with questions submitted online over the past few days, but if you have questions throughout, please email those to forum.questions@wku.edu. Because there are many facets to our reopening plan, we will be dividing forums by topic. Today's forum will focus on general campus safety guidelines, testing, tracing, academics, course adjustments, housing, and dining. On Wednesday, we will add panelists that can answer questions about student activities, transportation, Greek life, the Preston Center, athletics, and more. I'm joined today by experts eager to answer questions. Let me introduce them. Rob Hale, Associate Provost of Academic Affairs, to answer questions about classes and course delivery. David Clark, Director of Environmental Health and Safety and lead of the WKU COVID-19 response team, to answer questions about WKU's testing and protocol and new operational norms. Manette Ellis, Associate Director of Housing and Resident, to answer about the on-campus experience for students. Lynn Holland, Dean of Students and Vice President for Student Life, answering questions about its individual responsibility to keep our community. President Caboni has chaired WKU's COVID-19 task force that began meeting this past year and questioned WKU's to welcome to campus on the many facets of WKU's big restart plan. Chris Jensen, Assistant Students, to answer changes your service. Sharon, Assistant in Research in Housing and Residence, to answer you family 2020. Director of Marketing for the WKU Restaurant Group, answering questions about the operations of WKU's restaurants and dining facilities. And Chris Thorne, CEO of Graves Gilbert Clinic, WKU's partner for PCR testing for COVID-19. Thank you all for being here. We will jump into our questions in just a moment, and a reminder, you can submit your questions right now by emailing forum.questions@wku.edu. But first, President Caboni, can you start us off today by sharing some of the work that's been done over the summer to prepare to reopen our campuses?
Thank you, Amy, and thanks to everyone who's joining us this afternoon. It's been 5 long months with thousands of individuals working hard to create a safe place for you and your students to come. It feels like both 10 minutes ago and 10 years ago that we went remote this past spring. Our faculty and our staff have been working tirelessly to create a place for your young people to come and have a WKU experience. Now, it's going to be a little bit different than it was last year, but we know that for us to be successful and meet our institutional mission, we're going to have to, number one, learn to live beside this virus. And for us to get used to anything that looks like normality, we're going to have to do a lot of things that are a bit different. So to parents and to students, a lot of folks have worked really hard to get us to this place. Now it's on each one of us to be able to continue it. And so if you hear one thing from me today, wear a mask, stay 6 feet apart, and socially distance. And that means the entire time you're here. Young people, I want you to hear from me. I know the distraction and the temptation you're going to have to gather in larger groups and do things off campus that maybe in previous years might have been okay. This year, we're going to need you to work with us and not do that. It's going to be an interesting time for all of us. But I tell you this, there is no place that I would rather send my young person to college at WKU. I don't have kids of my own, but I've got 20,000 young people for whom I'm responsible. And I want you to hear from me that the places where your students will live and your roommates and the places we've created for you are safer than other options available to you. The restaurants here on campus have undertaken protocols and we think are safer than perhaps other places you might visit or choose to go in the community. And lastly, we know the educational environment that we've created is remarkably safe. But we also know that this is not without risk. We can't create an environment that would be virus-free. But if we all do our part, if we all wear our masks and socially distance, we have the best chance possible at having a somewhat normal semester until we have a vaccine and we defeat this virus. So we can't wait for you to arrive. I know some of you have stopped, dropped, and dropped and go with the drop off at the residence halls, and we're really excited to have you all back here with us.
All right, thank you, Dr. Cavoni. Let's hand it over now to David Oliver, who's been on the front lines of these plans, to just kind of give us an overview of testing and tracing before we start with questions.
Okay, Amy, I appreciate it. I want to just cover some of our key points. First of all, I really want to thank our partners in this, and Chris Thorne's here today with Graves Gilbert. We work with Medical Center Health, with the Bear River District Health Department, as well as the Kentucky State Department of Health. In every step of putting together these plans, we continually work with them, talk to them on a regular basis to make sure that our plans are up to date with the latest conditions that we're seeing with this virus, because I don't have to tell anybody it's a very dynamic situation. It evolves, and we're going to make sure that we're on top of that. One of the first things I'll talk about is the daily health check requirement. We do have a policy on that for every faculty, staff, and student. That before you come to campus, before you leave your residence hall, is to make sure you don't have a fever and to check the list of potential symptoms. If you have any of those symptoms that tie in with COVID-19, we want you to reach out to Graves Gilbert, to our clinic on campus, to your healthcare provider for guidance, but do not come to campus, do not go to class, stay in your room, stay at home until you can get that checked, get tested, whatever the appropriate protocol that the healthcare professionals tell you. That is really key. That's one of the first stops. Testing is, again, one of the things that we've thought a lot about. We put a lot of effort into it. We're going to offer testing on campus, and Chris can talk a little bit more about their testing capabilities, but we will have him here on campus and at other Graves Gilbert locations around the city, which will be readily accessible on weekends, etc. And the testing guidance that we're following is what has been issued by the Center for Disease Control and Public Health. And that is anyone that has symptoms that are similar to COVID-19, we want you to get a test. If you've been in close contact with somebody who's been tested positive for COVID-19, we think you definitely should get tested. And if you've been contacted by public health as part of contact tracing and they advise you or direct you to quarantine, we think that you should get tested there as well. And if a physician writes an order for a test, it could be a pre-procedure or it could be other risk factors. That's up to the doctor. They can write you that order and we'll get tested. Testing costs will be covered for faculty, staff, and students throughout the public health emergency on campus. Contact tracing is another area that people have talked a lot about, and there's have been obviously questions and concerns. All contact tracing will be completed by public health. We have dedicated contact tracers who have been assigned to work cases involving the campus and WKU with our regional health department, and we will support them every step of the way. Our goal is to through our testing process and through our education process for faculty, staff, and students, is identify those cases early, get them into the hands of the contact tracers, so we minimize the potential for the spread of this virus. So they will work through that. They will do the contact tracing. They'll identify potential contacts, and they will contact anyone who fits that contact criteria that they have. So they're responsible for contact tracing and notification as per the law. Again, what is a contact? I know that's a question that comes up. A contact in their eyes is being within 6 foot of an infected person for 15 minutes at a minimum. So as we talk about social distancing, we talk about the classroom environments, we talk about wearing masks, all of these things are put in place to try to limit the potential for contacts. And I think it's important to how all that ties together when we put them in place. Medical management, again, we have Graves Gilbert on campus who will be our primary medical management group for cases. Obviously, if you have another physician that your personal physician is, you can use them. But if you need a physician or you need that service, they will have that available. And then we'll also have a dedicated team that's going to be a support team to respond to and help support any cases that come in place. We also have a quarantine plan for students that live in on-campus housing. The plan has provisions for quarantining both people that are symptomatic and asymptomatic who have tested positive, as well as those who have identified to contact tracing, may not test positive, but still have to quarantine for 14 days. And we've set up, working through our Housing Residence Life, we have availability to deliver meals to those folks. We have linkages to healthcare through Graves Gilbert, our counseling and testing services. We'll have direct contact as well as academic support to make sure that the students can keep up with their studies and not have any issues if they have to quarantine. And then finally, data related to the COVID-19 cases on campus. We have launched a dashboard that's part of our Healthy on the Hill website, and we will be updating on a weekly basis with numbers related to the number of tests conducted, the number of cases on campus, with some demographic breakdowns, and those will be readily available, updated weekly, so that we can keep the campus informed of our status. Amy?
Thank you, David. Let's start with our questions right now. The first one says, I would like to know why students are not given the option to take the courses online versus in the classroom during the pandemic. Some of us have family members who are a high risk and students that may be a high risk. So Rob Hale, we'll let you address that.
Thanks, Amy. One of the challenges we've had since May we've been working on is trying to have a mix of online courses and hybrid courses and face-to-face courses, because different students want different types of experiences. So we put together what we think is a good mix of online courses and face-to-face and hybrid courses. So if your student is having trouble making schedule adjustments, I encourage you to have your student contact their advisor, and we'll do our best to try to change things up to give you the experience that you want. But we can't do it in every case, but we'll do our best.
All right, next question for Manette in housing. If a person did have to self-quarantine at the specific dorm for COVID, would the room be fully furnished, bedding, fridge, other things, or would the student have to bring it themselves?
Thanks, Amy. If a student is required to move to a quarantine space, we will have everything there, hard furniture for you, and then we'll actually have a person who is our point of contact for quarantines that'll give you a packing list and instructions of how quarantine will go. We'll reach out to you for your needs as well as the meals that you need while you're in quarantine.
All right, Dr. Gaboni, I think this one would be best for you to answer. At what point would campus shut down again, like spring 2020, and what would the plan be?
Well, we hope, and we would not do what we did in spring 2020, which was a shift to remote instruction. We're much more prepared with 5 months of notice to know what it would look like to shift modalities. But remote instruction is not something we're going to do again. We are prepared, if necessary, to change the way in which we teach, including some online instruction. But I'll tell you this, if we're all able to follow the guidelines and the Healthy on the Hill work that we've done, wearing a mask, staying 6 feet apart, and practicing good hygiene, that plus good testing, quarantining, and isolation with contact tracing will allow us to work through the semester. We watch a range of metrics, so there's not just one number that we would see and pull a lever. We look at the percentage of cases that are positive during the course of the past 7 days. At the state level, good news, that went down again for the 4th straight day in Kentucky, and also went down in Warren County today. We also take a look at the number of reported positive cases over the past 7 days. And that also has gone down in Kentucky and Warren County. We know that masking works and that we're going to be able to get this under control if we continue doing the work that we've been doing together as a state, as a community, and in 3 weeks as a campus community. We'll also take a very close look and monitor the beds and the hospitalization rate here in Warren County and the bed usage rate here in Warren County. And then we'll also follow the guidance of state leadership and county health officials to make sure that we're doing what they need us to do. But our hope is that with everybody working together, we can get through this through the end of the semester. And again, it's not going to be like last year, but we want to make sure that we still offer that WKU experience to you, no matter the format, the modality, or how we engage with you here on the Hill.
All right, next question is for Lynn Holland. What would be the consequence for not wearing a mask? Would there be a level to those consequences?
I think that's an interesting question, Amy, and it's one that's coming up quite frequently. And we are going to operate from the assumption that students are going to wear a mask. If you think about it, we are in the business of setting high expectations for our students. We are in the business of helping educate them and then helping them usher into adulthood. So the assumption is then that students are going to wear a mask. Now, we know that we will have outliers, but they will be few and far between. And we do have a mechanism in place through my office and the Office of Student Conduct to assist a student in engaging in the behaviors that we want them to engage in. Multiple tiered process. Nevertheless, we want students to do the right thing, to assume responsibility for themselves, but to also assume collective responsibility for those that they are going to come in contact with.
And we have 2 questions for housing yet again. That's a popular topic. Manette, are the students allowed to stay in the dorms during Thanksgiving break and before semester exams? That's the first question.
Students will be allowed to stay in the rooms during Thanksgiving break. Usually we close majority of our halls during that time, but we wanted to provide students the opportunity to stay so they don't have to travel back and forth from home. And so all 15 of our halls will remain open during that break period until we close in December.
And then the second question to that is, should my students' classes be changed to all online, will they have the option of leaving campus and receiving a housing credit?
I think like Dr. Carboni mentioned, our plan is to stay open even if we do move online. So we know that students need a place to stay, a place to study, and we want to be able to provide that home away from home from them. So our plan is to remain open, and we will not be providing any refunds as to our contract is a semester at a time.
Nina Schaumler, this question relates to food. What will be in place to ensure workers are not preparing food and are potentially positive?
Thanks, Amy.
We have the same daily checklist that the CDC and other institutions have put out, that all of our employees will be self-checking daily, and then managers will also be taking temperatures as students and employees come in. So we'll have that as well. At our time clocks, we also have questions concerning the different COVID symptoms and if they have had any of those. If so, they don't clock in and they come and the managers handle it from there. But we are working with all of the guidelines that are out for restaurants and ensuring that we don't have employees there working with us and around the students that do have those symptoms.
Now, we got a live question that's come in during the time that we've been on air for Manette again. What is the visitation rule for residence halls? Can parents return after move-in to assist with organizing the residence?
Oh, thanks, Amy. Our visitation for the fall is every student will be allowed 1 visitor at a time. And if you did participate in Top Drop and Go, we had around 1,300 students participate, which is really exciting. You can come back with your student. We just ask 1 parent or family member after you come back, only to help us socially distance with those other students who are moving in concurrently as you return to campus.
All right, Chris Thorne, we have a question for you. It says, body
here on campus. We process those in-house, so we can get the turnaround response for that very quickly. As far as people being available for antibody testing, we're not going to deny tests to anybody, but generally speaking, follow CDC, the health department, and whatever your healthcare provider feels is appropriate is the primary objective here. Difference between PCR and antibody tests are important because PCR tests are very, very important. They're live virus tests. It takes several days to a week or 2 weeks to get turnaround for responses. So during that time frame, what we do is we do target testing. We screen everyone with antibodies, and those we screen every asymmetrical person with antibodies. And then as soon as they come back with a positive, we jump on them with a PCR test. So that provides real quick turnaround for PCR test. It also provides a cost-effective way of taking care of the students, addressing their needs.
Thank you. David, I want to switch back to you, and you touched on this in your remarks, but you said it beautifully in a story that you and I worked on last week. What happens when a student tests positive and they were in-person classes? Is everyone that was in that in-person class and exposed expected to quarantine for 2 weeks?
Thanks, Amy. The answer to that is no. Our classrooms there's a lot of time going into setting these classrooms up. And we are socially distancing. We've reduced the capacity of these classrooms. So when you come in, you will see designated seating and they are socially distanced in those cases. Plus, we're having everybody wear a mask at all times in the classrooms. Our goal with that is that if someone does test positive that's been in class, there should not be a contact because you're not going to be within 6 foot of the other person. And that's why it's very important to maintain that social distance in everything that we do, as well as wear the mask. So the answer to the question is that obviously the contact tracer would look at the situation, but in those cases, it should not be a contact. So no one should have to quarantine other than the person that's infected.
Thank you. And Manette, let's get another live question that's come in for you. If a student has all classes transitioned to online delivery, can they be exempt from the on-campus housing policy?
Thanks, Amy. If a student finds himself currently, before the semester begins, that all their classes have transitioned online, they can go to their housing portal through the website at wku.edu/housing and fill out an exemption request. And so we find that students have been doing that as their class has been online and been exempting those students. And so you just need to go through that process of filing an exemption.
All right. Let's go back to Nina for this question because we've had it a few times. How will social distancing be enforced during lunch rush? DSU, Downing Student Union, is regularly crowded for long stretches of time in the middle of the day.
Thanks, Amy. We've been working over the last several months rearranging many of our dining facilities. We will have crowd control and signage, decals on the floor, signage in the areas, reminding students to social distance, showing them where they can stand while they're waiting for their food or placing an order. We will also have the stanchions inside some of our some of our restaurants so that they can kind of know where they need to be standing in line while they're there. We will also be placing mobile ordering in some of our busiest locations. So we will have that option as well. So students can place that order and then simply come in and take that food with them instead of having to stand in line. But ultimately, it is going to be the responsibility of all of us, guests, customers, and the students, to be sure that we're following those guidelines, having our mask on when we're in our restaurants, and then also doing the social distancing while they're there as well.
Thank you. Rob Hale, let's get you a question. It says, my son has decided it is best for him to commute given the current situation. He has a class that went online, that is online, and then 15 minutes following that class, a class on campus. Then 15 minutes following that class, an online class. Will there be ample study spaces available so that he can log into Wi-Fi without sitting in his vehicle?
Short answer is yes. We're working on that right now. Now that we've got the classrooms assigned, we're going to the other smaller rooms to create Zoom rooms where students can go in with headphones and participate in class. So we're putting together a guide for that, and hopefully by the end of next week, we'll have a guide put together with all the protocols in place for that.
Okay, and David Oliver, will all students be given PPE or just the students living on campus?
Our expectations are that students, because of all the requirements in most states are coming from now, should already have masks. They should bring those masks with them. We're also going to be readily providing them in vending machines. We're going to have them in our small pod stores, as well as our bookstore for them to have availability.
Okay, and to stick with you for a quick second, a live question that just came in. If students stay 6 feet apart in class, is it still necessary to wear a mask?
Absolutely. They go twofold. Anytime you're inside a building, in a classroom or other common area outside of a private office, when you're alone, you have to have a mask on from the time you enter that door until you leave. And again, it's very critical that we do both social distancing and wear masks.
Okay, Chris Jensen, this one will go to you. Will there be a way to opt for all online classes this fall?
Sure. We have lots of advisors that have been working with our students. We do have a very strong and large incoming class, so availability is becoming limited. I would encourage students to reach out to our academic advisors, and we will try to work with them the best we can. They can be reached by calling 270-745-5065, or you can email us at academic.advising@wku.edu, and we'll try to assist the best we can.
Very good. Manette, have you talked through the cleaning process for restrooms in the residence halls? What are the cleaning procedures in place over the weekend?
That's a great question, Amy. We have increased our cleaning protocols for all the residence halls, including on the weekends. Actually, if you go to our wku.edu/housing/restart, you can find all of the chemicals we use, our process, and the schedule of our planned cleaning, as well as we will have an opportunity for students who want to use study spaces or common spaces to check out a cleaning kit at the front desk. So you can clean before and after usage. Just a little personal responsibility to make you feel a little bit more comfortable about the study spaces you're using, as well as we'll have designated places throughout the halls where there are called high touch zones that we will be cleaning more frequently, i.e. elevator buttons, front doors, front desk counters, where our students will hopefully see an increased cleaning schedule throughout the fall semester.
All right, thank you. David Oliver, this is about taking a student's temperature, which I know you want to reiterate. I think Dr. Cavoni has said this before. If you have a temperature and you know it, please don't come. But will there be certain areas or buildings where students' temperatures will be taken every time they enter?
No, as a general rule, this is going to be self-administered for faculty, staff, and students. There may be some specific areas, private lessons in the music department, for example, where there's close contact, where they will have the capability before that lesson starts to take a temperature. But otherwise, in general, it is going to be the requirement that this be self-administered before you leave home. Because if you've got the fever, we don't want you to come to campus, then realize you have it. We want you to realize it before you leave home. So it's important that we do that.
Okay, let's go back to Nina. This is a popular question involving the meal plan. Are students still required to purchase a meal plan this fall? Thank you.
Yes, any first-year student, any first-year resident student coming for the fall 2020 semester is still required to purchase one of the traditional on-campus meal plans. If you're a student that does not fall into that first-year category, you will be auto-enrolled into the Flex program, which is $300 for the semester. If you do not have 3 or more face-to-face classes, however, those off-campus students would be exempt from the Flex plan.
And so they would be refunded that money, or it just never would come out of there?
It would, if they were exempt from
Yes,
the
right.
Flex plan, once the university has all of that information and shows that all of those classes are online and they do not have 3 or more courses face-to-face, that charge, if it had been put onto the student's account, would be taken off at that point.
Great, thank you. Dr. Caboni, this one's for you. Does WKU intend to discount tuition for classes that are online only?
Thank you, Amy. We made the decision last year not to increase tuition on our families this year. And so we've held tuition flat. But we made another move that I think is really important for all of our families. We used to have a $150 per credit hour fee that we placed on online courses. So if you've been in a program that has not previously been online and you're taking online classes, we didn't want to increase any tuition on you. And so for a typical 3-hour course, we've waived that $450 fee. There's no additional charge to take online classes, and we're proud of doing that. We want to make sure that we didn't add any additional burden to our students and our families because of choices that they make during what is a once in a century challenge for us as an institution.
All right. Rob Hale, will online classes convert to in-person later in this semester if the COVID situation allows?
No, if a course is transferred online, and it will may shift to remote spring. We've been working really hard all summer long. I think 350 of them have gone to different training sessions over the summer to make their online courses more engaging. That's one of the main things they emphasized. Now, that may not sound like a lot, but this is on top of 600 sessions that they participated while we were in the midst of the COVID crisis in spring semester. So I just want to emphasize that the online courses that you had in the spring, especially if they were remote courses that flipped, these online courses are going to be much better. We're really emphasizing engaged learning in those classes.
Back to Manette, you may have touched on this, but just to clarify, is there a limit on the number of people who can assist students with move-in?
There is not a limit if it's your first time moving into campus. So if it's your first drop off for top drop and go, or if you're moving into master plan or for a special population, you can bring as many people as you'd like. We just ask that you keep that to a minimum. So as we try to keep social distancing for you and the other students who might be moving into the halls.
And for Sharon Hunter, how will students in quarantine get food?
That's a great question. Students in quarantine will fill out an online form and indicate their menu choices, and then that will be delivered to the quarantine location.
And back to Nina, for what will the dining options look like for students during the restart? Will the open dining experience of the Fresh Cafe be the same, all you can eat? Will students be able to sit in the dining halls?
Okay, thank you. So the restaurants here on campus, they are going to look a little different when you return. If this is your first time, it will look different than it did last year. Some of the smaller locations, we've had to remove a good portion, if not all of the seating, so that we can make space for students coming in, waiting for food, coming in, standing in line, or getting mobile ordering. So for Fresh Food Company, we have limited the seating. We are always following the guidelines for seating. So currently it's at 25%. As that changes, we will be able to either increase or need to decrease that percentage. However, we will have some in-person dining available. Students will also be able to get food to go in all of our locations, even in the Fresh Food Company. Currently, as students are coming in, they will be given a to-go box at each individual station, whichever ones they want to go to. And then that way they can then either go sit down and eat, or they can take it to them.
All right. Bob Hale, talk about, there was some talk about classes being held possibly in DSU or the Alumni Center. What is the progress on such a plan, and are there restrictions for what colleges are permitted to use such spaces?
Amy, right now we haven't had to go that route. That was one of the early things we planned for in the restart. We are probably going to use some of those spaces for testing, academic testing, not COVID testing. If we need a larger space for a large class to be able to take a traditional test all at once. But that's probably the only thing we'll use those spaces for.
All right. David Oliver, here's a question that has come in. If a student is unable to wear a mask for a medical reason, what is the protocol for assisting students or providing an exemption?
It's a good question, Amy, and will be treated as with any other situation. They will go through our Student Disability Services group, and they will be evaluated based on that criteria. And Lynn, I don't know if you want to add to that, because I know that's in your area.
Thank you. Yes. So a student who has a pre-existing medical condition is asked to contact the Student Accessibility Resource Center and complete the process. It's a registration process and provide medical documentation. And we will look at this on a case-by-case basis and determine what we can do, how we can accommodate you, how we can accommodate the student. It's pretty straightforward. So with questions, just real quick, with questions with that, you can contact me at my email address at deanofstudents@wku.edu, all one word, and I'll walk you through the process on how to do that registration.
Well, Lynn, just to stay on the mask theme, and Dr. Carboni, you too, will professors or faculty be permitted to ask students to leave their classrooms or offices if they are not wearing masks? You can both speak to that if you'd like.
Well, I'll take the first crack at it. It's real simple. We just want everybody to wear a mask. And so we don't want to have those conversations. If you're on campus in a building, put your mask on. That goes for faculty, it goes for staff, and it goes for students. If we do that, it's really easy to get through the day and do what we have to do. Now, I've been a faculty member and I've taught classes. The same way if a student walked into my class, picked up their phone and started talking on it, I'd probably ask that student to step out and have that call in the hallway. I know I would. I've had to do that before. If a student comes into class, I'm not going to let them in. I'm going to say, I need you to put your mask on. If that doesn't work, I'm going to have to say, look, everybody else has their mask on. You really need to put your mask on. It's part of what we're all going to do to keep each other safe. And so let's hope that we don't have to have those kinds of difficult conversations. But if a student doesn't want to wear a mask and continues to come to class, a professor is well within that professor's rights to drop the student from the class. We need to ensure the health and safety of each member of our community. And the only way we do that is by wearing a mask.
Thank you. Sharon Hunter, David has spoken a little bit about what happens with quarantine, and what the question here is, what is the plan for students if they happen to have COVID? Do you want to speak to that, or David?
Anyone?
I'll take a stab at it. What happens is we have a very detailed protocol. If the student is positive and symptomatic or positive and asymptomatic, there is a whole process that we go through to make an assignment of housing. They need to be moved, setting up the meals as we've discussed before, as well as academic and counseling support. So there's a whole mechanism that comes into play when that happens. And again, the Healthy on the Hill website is a wonderful resource for you.
Sharon, what would happen, not to jump in, if a student was contact traced, so they've come in contact with someone, but they're not symptomatic? What happens then in their room? Because we're treating each room like it's a household. So can you talk a little bit about the thought behind that?
We do treat it as a household. However, that household may be separated.
Okay.
If the student needs to be isolated for the 14 days, then we have housing available for that student so that they can safely do that and maintain the safety of the original household.
But if both of them happen to either test positive or both be contact traced, they might be able to stay in the same room.
Absolutely.
Okay, great. Minette, let's talk to you about this question that just came in. If a student is granted a housing exemption for the fall semester, or if they choose to stay home, will they be able to get a room assignment for the spring semester?
Yeah. Thanks, Amy. Absolutely. So if a student is granted an exemption, let's say that you find out your classes are online, all you need to do is to fill out a housing application for the spring semester. Those goes live on the housing portal in October for the spring semester.
And can you reiterate, how do you submit a request for the housing exemption?
Yeah, in order to submit a request for a housing exemption, you just need to go to your housing portal. It is a section within the application. You just fill out all the information. We have a person that reviews those, and you're healed back within 3 to 5 business days about the decision.
Okay, we may stay with you, Manette, or Nina. I'm not sure. I'll just read the question. It says, I know all classes go online after November 20th. If students leave campus for the remainder of the semester, approximately 3 weeks, will their food plan be prorated or adjusted for the weeks that they are not eating on campus? We've sort of talked about that, but just kind of explain what campus is going to look like in those 3 weeks that are remaining. Do you want to talk about the housing first? Or?
Oh, you can go ahead with the time.
Okay. So for the dining side of things, we will still have restaurants open even after the Thanksgiving break. But we do realize that some students either won't return, don't feel like returning, and some students will. So what we've come up with is we will allow for those last 2 weeks after Thanksgiving break for any unused meals in the weekly meal plans to roll over to the spring semester. So those students that don't return will be able to still utilize those meals for the last 2 weeks. In the spring semester, they will be loaded onto their card. They'll be able to use those in our Fresh Food Company and our Hilltopper Hub location anytime during the spring semester.
And for the housing portion, we will have students who we know cannot go home or need that on-campus housing. So that's why we are remaining open, as well as to protect those family members who might be at home before the winter break, so students don't have to travel back and forth. So we'll send out information in early November to see students' intentions, just so we know who will be staying in our buildings, but we will be fully operational during Thanksgiving break and afterwards.
All right, and Nina, another question that just came in. Will the hours of restaurants across campus be similar to previous years?
Absolutely. We are planning to open all the campus restaurants with the same hours that we had last year during the fall and spring semesters. And those hours are up on our website. If you want to go to wku.edu/WKU-WKURG.
Okay, and forgive me if we've touched on this. Here's a question. For those people who cannot wear face masks, will they be allowed to help students move into dorms? Also, will those family and friends be prohibited from accessing other parts of the university, including yet not limited to the dining halls, library, sporting exercise facilities, and other buildings? I'm not sure who.
Probably David.
Yeah, I'll take that.
Okay.
I would recommend that if someone has that situation and they know that their student is coming to campus, to reach out to us. We'll try to work with them. There's really not a lot of alternatives to we're not going to have somebody not wearing a mask, but we will try to work with them on an individualized basis. And they can contact our COVID line or email me for that example, and we'll be glad to work with them as ahead of time is the best time for us to try to figure that out.
Thank you. Sharon, let's ask you this. Will parents be contacted if their student has been notified by a contact tracer? Will parents know if their student has been quarantined?
That is a HIPAA requirement. The student is an adult and we don't have permission to share that information. What I have told students in the past about these types of things is we strongly encourage them to speak with their families. They're going to need your support. So that is just a natural consequence of that. I don't think it needs us to be involved at all.
I might suggest, Chris, because I know they can, on the HIPAA form in your case, you want to allude to that? I mean,
Sure. There is a HIPAA health form that allows a student to exempt one person or another person from sharing the information. We recommend that this happens, and they do this with the parents. So we'll have a form on file that can help with that.
Okay. Manette, if it says my daughter might or might not have a roommate, will it affect the dorm fees?
Yeah, if your student finds that they don't have a roommate right now, it will not affect any charges. They won't be charged any extra. They will have options. So they'll have the opportunity to either find another roommate, look and see if anybody else would like to move in them, or they can buy out their room for an increased price as a private room, but they will not be charged any extra if they end up not having a roommate for the fall semester.
Okay. Sharon, there's been a few questions about master plan. Will there be anything for parents at master plan this year, or should they only plan on dropping off?
We are still planning on that. We're looking to finalize that in the next couple of weeks. However, I think we're going to move more to a virtual session. And those have been very, very popular with our students this semester so far, or this summer so far. So pay attention to the parent portal.
And David Oliver, this is a question for you. We need to break this down a little bit. If a student gets tested, are they required to quarantine while waiting for the test results? How long will it take to get those test results? We'll start with you, and if anyone else has.
Well, I can answer the first part, and Chris can talk about the test results. If they have been contact traced or they have been in close quarantine for 14 days, then yes, it would. If for some other reason they get tested and it's not directly related to a quarantine order or a reason to be quarantined, the answer is no. They wouldn't have to quarantine just because they got a test. If it was a pre-test for a medical procedure of that nature, if they're symptomatic, then they would be quarantined for 14 days. Chris, you want to talk about the test results timing?
Sure. Again, falling back on the CDC and Department of Health, will follow those requirements. But with a symptomatic patient, they would test them, and that they should be quarantined during the turnaround time for that. The turnaround time for that at presently in our organization right now is 48 hours. Might be as high as 72 hours, but test results have been in the last 2 weeks have been coming back in 48 hours. We're also working on a program to design a test that is processed in-house, and in that situation, we can get it back the same day. People who are asymptomatic, a little bit different. They can test, and that antibody test will come back probably within a day. And in that situation, quarantining is not really necessary.
Thank you. Just want to remind you that if you do have questions, you can still submit them by emailing questions@wku.edu. We will be having another forum on Monday at 8:00, and we will be taking some more questions regarding visitation, student activities, things like that. About it because it relates to, do we need any type of parking permit?
Currently you do not. So we have great videos that we've created this summer that'll walk you through what the move-in process looks like. It's going to look a little different this fall. And you can check those out at our website at wku.edu/housing/restart. It'll walk through all different types of move-ins that we've designed this fall. Take them to your room, and then it'll be directed to move your car to a lot during those move-in days. And then you'll have to have your parking permit once classes begin.
Rob will send this your way. Who determines if a class is in person or online? How will we know if a class has been transitioned?
Great question. The faculty have been working with their department heads to determine if the course is face-to-face or online. And most of those are so a student can look up net and see what modality, what type of course they've got. There's a way you can go through TopNet to see your consolidated schedule, and it'll break down, for example, if you're a hybrid course, you might only meet one week. Your professors will be contacting and reaching out to you also. If you go to their Blackboard sites, and those are still under development, but many of those are pretty far along. You can look at the Blackboard site for your class and get a better sense of how the course is going to be delivered to.
All right, thank you. Aaron, can you have delivered to the like?
You can, but we're doing contactless delivery, so it would be just like it would at your home. You place the order, and then the student would meet the delivery person at the door.
And then the question is, are hybrid classes available entirely online? Rob Hale?
No, that'd be an online class. I mean, we have some online classes that are going to do synchronous Zoom sessions, and some of them are having won't have those synchronous Zoom sessions. But by definition, it would be an online class. Hybrid is going to involve some sort of face-to-face.
I have two quick housing questions for Minette. One is, if we know the dorm and room of our child, what's the address that we should use to send packages?
That's a great question. We get tons of packages, so understand that question. You can actually go onto our housing website, and we have all the residence halls information that'll show you the address for each residence hall, as well as the dimensions of the room, suggestions on things to bring. And so I highly suggest checking out those individual residence hall pages for all of that information.
So that would probably answer my next question, which was sent in that said, is there an existing curtain rod or anything in place to hang up a curtain in the dorm room?
There is not, but there's dimensions of the window, so you can purchase one. There's also dimensions of the floor for rugs. There's dimensions of the beds, so you can make your own headboard. So we have tons of information on the residence hall site. As students, we highly encourage them to customize their space to make it feel like home.
All right, and this one, I guess, would be for Rob Hale. Will WKU excuse absences due to COVID-19?
That's a lot easier than the curtain rod question. What was the question again? I was so caught up in my joke.
Will WKU excuse absences due to COVID-19?
Yeah, we've been talking to professors about being as flexible as they can be with students. Obviously, if they're sick, arrangements will be made. We're not going to penalize anybody for being sick or for staying home because they have a temperature. But one of the key things to do is to communicate with your professors. I mean, I think it's more important than ever. It's always important to communicate with your professor, but it's more important than ever to keep those channels open. So keep them posted about what's going on if you have to miss class.
Okay, sticking with you for a couple more, I'm going to ask this one that was sent in. Will online lectures be saved so students can go back and review for a test?
Sometimes. It depends on the professor. The professors have a lot of latitude in how they organize their classes because they know what works for their students. So you'll be able to know that. So again, that's another great question to ask your instructor. I suspect if you look on the syllabus or on the Blackboard site, you're going to be able to tell if they're going to be recording lectures or not.
Okay. David, this looks like something in your wheelhouse. How will WKU limit capacity in small spaces like elevators?
In each of the elevators, we've elected to go to a four corners process, which was one of the suggestions that we've looked at in best practice. There will be stickers for, and it will show the direction if you walk in that you're facing the wall instead of each other. So that one is simplified itself because we looked at a lot of different opportunities. Because you got bigger elevators, smaller, we just said we're going to go with four, one in each corner. And that's across the board.
Okay. This question that's being typed in now also appears to go to you. What supplies should students bring? Do they need to bring sanitizer, disinfectant wipes, thermometer?
We're going to be providing in the common areas and classrooms and other sanitizer and towels. For folks in the residence hall, obviously, the residence hall guides will tell them, but I think that's just prudent for folks to bring that. I think the thermometer is a very good idea for the health checks, and including that in the materials that you're bringing to campus with you. And again, having one available, whether you're a residential student or a commuter, you need to have the thermometer available to do that daily health check.
Rob, why don't we wrap up with this question with you? Can you talk about, I know it's specific to the different classes, but how lab work will work if it's online? Do the students meet with the professor for hands-on work? Someone asked about art studio availability. What can you say to people questioning how labs are going to go?
It depends, like so much. And most science faculty and arts faculty are doing face-to-face labs. But you'll be able to see on TopNet which venue it's going to be in. Even during the remote time, faculty were very creative in coming up with ways to do online. Trying to do most of those labs and studios that way. Again, check out the Blackboard site, check out the syllabus on TopNet, and you'll get a better sense of how those are going to go.
All right, thank you. And we are still receiving several questions about testing and tracing. We have discussed this earlier, but before we close, David, will you quickly go over WKU's testing availability and the protocols?
Yes, we'll have the testing available on campus with Graves Gilbert Clinic, and our campus clinic is open Monday through Friday, but they have other locations close by in Bowling Green that are open on the weekends, so the people will be able to get tested 7 days a week. In that, our guidance for the focus of our testing is based on the CDC guidelines, but again, we've left the opening there for physicians' orders. If you seek either your own physician, he goes to Graves Gilbert, they do an analysis, they can order a test for you, either the antibody or the PCR, and I know that'll be available.
Sure. We should be talking a little bit about telemedicine right now, because people who are symptomatic, they have a temperature, it's best if they call in, and we have a complete telemedicine set up for this to be able to accommodate that. We're open on campus Monday through Friday. We're open 7 days a week throughout the community, 7 to 7. So our telemedicine will be up and working during that time, as well as face-to-face visits. Our lab will be processing all weekend. It churns. It basically doesn't stop. So we'll have all sorts of ability and capability for your loved ones. Okay.
Great, so much good information. Thank you all so much. As we conclude this open forum, we want to thank the panelists for being here. A special thanks to the thousands of faculty and staff working countless hours this summer to prepare for your return home to the Hill. And we just appreciate the audience we've had today. If you have specific questions that we did not answer, you can also send those to covid19@wku.edu. And a recording of today's forum will be available on our Facebook page and on wku.edu/Healthy on the Hill. This is WKU's online repository for all things related to the reopening. So we hope you'll join us again this Wednesday at 4 o'clock Central for our next forum. We hope you all will stay well. And in the words of Dr. Cavoni, go Tops.